While the immense pressures of the pandemic seem to be tapering off, Ontario's healthcare system has never seemed more fragile, stretched, and strained, on the verge of collapse with every COVID surge the province endured. Now, the federal government is offering some help, and Ontario has accepted.
A few weeks ago, we sat down to offer the provinces close to $200 billion worth of investments if they were ready to move forward in 4 targeted areas that will improve the outcomes and results for Canadians.
In Halifax this morning, Prime Minister Justin Trudeau said Ontario and the Atlantic provinces have agreed to this healthcare deal. A portion of the federal dollars have to be spent in 4 different areas.
Specifically, better access to family doctors, making sure that we're monitoring how many more Canadians every year have access to family care doctors and primary care teams. Moving forward on better supports for frontline health workers, making sure we're moving faster on credential recognition and licensing, making sure we're reducing the backlogs of surgeries, making sure that we're supporting people who are increasingly getting burned out after some long years of pandemic and continued strains on our healthcare systems. Moving forward on better mental health supports for young people, for all Canadians. And finally, we need modern healthcare systems that are grounded in better data collection, better information sharing that's going to allow us to have the best possible care for Canadians right across the country and ensure that Canadians are receiving the best possible care across the country by being able to understand and quantify exactly what's going on across the country.
Ontario will also receive $776 million through an immediate one-time top-up to address urgent needs, especially in pediatric hospitals and emergency rooms, and long wait times for surgeries, problems all exacerbated during the pandemic. The Ford government was asked today if all the money will really be spent on health care, or will the budget get rearranged.
This finance minister has been investing in healthcare at unprecedented historic amounts. I can commit that we will spend the healthcare money, because our number one priority is to make sure that not only do we have the investments today for healthcare today, to make sure that we can deliver timely access to healthcare, but we need to make sure that it's sustainable for the future. And let me just say what the Premier, what allowed us to get to this stage today was very much the Premier's leadership to say we need a fiscally sustainable deal. So what we've agreed to is both for the bilaterals, which have cliffs in years 4 and 5, and then everything has a cliff in year 10, an agreement in principle to have discussions well before to make sure we can continue the funding going forward.
The Ford government adamant that the province has been investing in healthcare well before this federal money came into play.
I'll tell you, we didn't wait for the federal government to land a deal to invest in emergency rooms or invest in the surgery backlogs, to invest in pediatric care.
Meanwhile, the Ford government tabled the Your Health Act bill yesterday that would aim to move OHIP-covered surgeries and procedures to private clinics. The NDP says that would make a bad situation worse.
We're going to continue to see more healthcare workers leaving our hospitals, leaving long-term care facilities. This crisis will grow, and it will also grow when they set up these for-profit clinics that can pay them more.